Hey, what's going on, everyone? Man, it's been a great week here. KYA has put on an amazing event. This is actually one of my favorite events here in my old Kentucky home. Just happens to be Child Advocacy Week. So just shout out to everyone who's just helped just put this amazing event involved here. Child welfare policy is important to me because I am a foster alumni. I'm a product of our system here in Kentucky, and I'm so blessed to be able to give back for years now, actually since I was 19 years old, and advocating for foster youth. I've been a part of several policy and legislative changes with my VOC group members. But here recently, I have taken the independent route with another very prominent youth advocate, Glenda Wright, and we have established our very own child welfare advocacy firm called Wright Hunter Consulting. And I'll put that information down in the chat box here later on. But we are very, very interested in improving the overall quality of care. So just amazing. Thank you all for being here today. And let's hop right down here to it. So we have several individuals on here, actually. So let's go around and introduce ourselves here, or introduce yourself to the people here. Started with Representative Jenkins down here.
Hi, I'm Joni Jenkins. I am a state representative from the Louisville area, and I also serve as the Kentucky House Democratic leader.
Nice to have you here. We have Ms. Tamara Vest over here.
Hi, Tyler. I feel like I haven't seen you in forever, so it's nice to see you again. My name is Tamara Vest. I'm currently serving as the chairperson to the Voices of the Commonwealth Youth Leadership Council. I'm also currently in a new position as a case manager with a private foster care agency in Kentucky.
All right, thank you so much. And then last but not least, I don't want to butcher your name here, so.
Hi, everyone. I'm Mahak Kalra. I'm our Chief Policy Officer at Kentucky Youth Advocates. And I just want to welcome everyone to Day 5 of Children's Advocacy Week. I hope you enjoyed the marathon of virtual events that we've had thus far and continue to advocate on behalf of over 1 million youth that are in our state as the legislative session moves forward. So I just want to guide everyone on why we're here today. This is our final sector-based policy discussion that we are having, and I am going to turn it over to my colleague, Shannon Moody.
Thanks, Mahak. I'm Shannon Moody with Kentucky Youth Advocates, and I am going to be helping lead the second half of the agenda today.
All right, thank you all so much. So let's hop on to it here. Started with Representative Jenkins here. You look so good today in your red. I like that. I like that. I had a pleasure of meeting you last year, actually with my VOC members as we sought sponsorship for Senate Bill 115. You definitely gave us your support, and we definitely appreciate that. So you've actually been in the House since 1995. Can you tell us a little bit about your position in your current role?
Oh, I'd be glad to. I was first elected in '95, so I'm an old timer around here. Most of my career I've spent on committees like Health and Welfare and Judiciary, and that's really where my passions lie. I graduated from the University of Kentucky, despite the red you see today. This is for Heart Day. But I cheer for the cards as well. I graduated from the University of Kentucky with a degree in communications, and have worked in a number of different positions. But one of the last things I did before retiring was work with foster youth who were transitioning out of foster care into college at Jefferson Community and Technical College, and just enjoyed that work so much and learned so much about some of the challenges that our former foster youth have. And that led me to work with now Speaker Pro Tem, Representative David Mead, on House Bill 1 several sessions ago, which was a big change in how we look at child welfare and kids in state custody and foster youth. So that continues to be one of my passions, and we continue to work together to think about ways that we can break down barriers for Kentucky's kids.
Definitely.
And so I guess in my current role, I didn't talk about that. In my current role, I lead the Minority Caucus. of 25, which is a small caucus, but historically we are over half female in this caucus. Of the 25, 17 are female, which is really, really amazing. When I first came to the General Assembly in 95, I think there were 4 Democrat women in the caucus. So it's a huge, huge change.
That's amazing. That's amazing. That definitely proves that we are moving towards progression. You did mention you were a UK alumni, but you look good in your WKU red today. I love it. I love it. Shout out to WKU right there. So what drew you to public service and your interest in the child welfare system, actually?
Well, when I first came to the General Assembly, I was working at the Center for Women and Families. So a lot of my early work was around victims of crime, especially women and kids. During that time, I became more and more interested in having served on the Health and Welfare Committee. The increasing number of kids that were going into state custody and what their outcomes were. And actually, Kentucky Youth Advocates played a big role in my education on those issues. And certainly when I was working one-on-one with youth at Jefferson Community and Technical College and hearing some of their stories and seeing the resilience that these young people had, it truly became one of the big passions in my career and in my life.
Definitely. KYA is always there to educate members of the community. I remember back when we were all legislating for sponsoring and advocating for Senate Bill 115, they played a big part in educating us and how a bill becomes a law here in Kentucky. So shout out to KYA, Shannon, and you all do amazing. Yeah. Look, I got to just call y'all out now. Y'all do a very good job. So part 2 of the legislative session is about to kick off here. What can we expect as far as upcoming bills? I know it's also a budget session and a very short session. Mm-hmm. So what can we expect in the child welfare arena here?
Well, I think that as you talked about the budget, because of COVID last year, we only did a 1-year budget. So we are working on the second year of that 2-year budget, the fiscal year 22. And I think one of the most important things that we can do is make sure that we are the funding in the state budget does keep an eye on what we're doing in child welfare. We have kind of a brand new cabinet with the administration changing last year. And so I've been working very closely with folks like Secretary Freelander and Marta Miranda, another alumni from the Center for Women and Families in Louisville, about what we need to do and how we need to fund our child welfare work. And certainly what we can be doing on the preventive end to make sure that if a child comes in state custody, they really, really need to be in state custody. I am very much in favor of front loading and making sure that we are doing interventions in families early before it gets to the point that a child has to be removed for safety reasons. Let's do that early intervention. Let's put some resources around a family. I always talk about the kids that I worked with. They may have had really bad experiences with family, but you know what? When they turned to 18, the first thing they wanted to do was go back and find their biological parents. There is such Definitely. A bond there. So if we could keep that biological family together and keep everybody safe, I'm willing to spend the money there. Then later having to go back and spend money in late interventions.
Definitely. That's probably the biggest contributing factor when it comes to just our child welfare system. Our state workers are just not paid enough. They're overwhelmed, and we're asking them to do a lot with minimum resources. I mean, some of these social workers have 60 cases on there, so therefore they can't efficiently do work. But the job is not appealing because of the amount of work that you have to do compared to the amount that you're being paid. So there's definitely a deficit there. So hopefully we can find balance here pretty soon. It's like in this session soon.
Right. The governor's version of the budget did have money in place for the hiring of I think 75 social workers. Right now, the budget is in conference committee. And so we will be meeting soon and looking at that. And that's going to be one of the number one things on my issue to make sure that we get in that. And again, thanks to the federal government, and I haven't been real complimentary of the last administration, the federal government, but the Family First legislation, which allows the state to use federal money to do those early interventions, I think is a real game changer for us.
Definitely, definitely. And even one of the bills that President Trump signed before he left office with the expansion of Chafee funds. So that was, very generous. So we're so glad and honored for that. But it's very interesting that you mentioned actually, of course, preventative measures and not allowing a young person to come into care unless it's absolutely necessary. So with Kentucky now leading for the third year in a row in child abuse, what is your take as far as what we can do to prevent that? And also, why do you believe that we do lead in that arena?
Well, I think a lot of it goes back on the drug problems that we have. The opioid epidemic has hit us very, very hard here in Kentucky. And I think, those two things are really linked. I think the START program that we have here in Kentucky that has small programs in only, some counties where it's when parents become involved in the court system through a drug problem, we start putting resources around the whole family. And I think that's really, really important. But we still have to address the drug epidemic here. And as somebody who lost a family member to an opioid overdose, that is another one of my passions that I'm always looking for answers to. And it's, access to treatment, it's early interventions. We know what works. We just need to put our money where that is. I always say our budget is our moral document because it's really where we outline our priorities and where we not only talk the talk, we walk the walk.
Exactly. I mean, are there any complications as far as, getting, I guess, the other party involved or on board with what we're trying to do here?
Well, I do think that child welfare is a bipartisan issue, and I think folks have seen who've watched the legislature of the last couple of years have seen me, one of the more liberal Democratic members, and Representative Meade, one of the more conservative Republican members, really being able to sit across the table from each other and find common ground and work together on these issues. Some other things that I think we need to look at, I think under-resourced families tend to have stressors that other families don't. So I think looking at raising the minimum wage, looking at subsidizing childcare so parents can work and make sure their kids are in a safe environment, early childhood education, all of these things are factors in making sure that we create a Kentucky where kids are well cared for and are able to have the opportunities to thrive. So I'm looking at all of those issues.
Definitely. Last question here. Why is it important for you to hear from advocates, and how can we get a hold of you?
Well, you can call my office at any time. I'm in Frankfurt a lot more now than I'm in leadership. So it's 502-564-8100. Just ask for me and you will get either me or somebody in my office. You certainly can use my LRC email as well. A lot of people tweet at me too, and I try to keep up with that. I always tell people that, and a lot of legislators won't admit this, but we don't know what we don't know. And people on the front line, people who are, personally affected by these policies, I think are the best people to talk to. I have access to a lot of experts, but actually talking to the families that have been affected and can tell me their stories. I like to put a face on it. I always say I like to touch it. I like to see it. I like to feel it. That helps me understand it better.
Definitely. Well, do you have any other remarks that you or comments that you like to make in regards to our child welfare system?
Well, I'm really excited about the leadership that we have in the cabinet now. I think we have lots of experience, but lots of heart there. And I really appreciate being able to come to you virtually. But boy, I'm looking forward to hopefully next year we can have Child Advocacy Day here at the Capitol, and we can meet with folks, one-on-one, and you guys can see government in action. Child Advocacy Day has always been one of my favorite days during session.
Definitely. Like, I loved it. I was just amazed. And actually that's, probably when I first started taking politics very seriously. So it's just a joy to be there. So thank you so much for, all that you're doing, as well as the other legislatures that are there as well. Thank you so much. It has been an honor to have this conversation with you and just have your support as well.
Well, thank you, and reach out to me anytime. And I'm looking forward to being able to sit down again across the table from you.
Yes, ma'am. Yes, ma'am. Thank you so much.
Representative Jenkins, before you go, and since we have you for a couple more minutes, I just wanted to ask, are there any bills that you're working on that we should know about as we're monitoring this upcoming session?
Well, in my position, I tend to support my caucus members more in their bills, but I'm real excited about the over 20 bills that the Women's Caucus unveiled earlier this week on maternal and infant health. I have a couple pieces of that, making sure that Medicaid pays for a whole year of a child's first life and for the mother, looking at the mental health issues that go along with maternal health. We have just a terrible record on maternal health here in Kentucky, and there's no reason for that. And looking at the racial and income disparities in outcomes. So I'm real excited about that. And of course, the budget is one of the biggest things that we're looking at to make sure that we are giving our child welfare workers a pay raise and increasing the numbers of them, and also offering them some help. I have a first responders bill that I haven't filed yet. It's not quite ready, that looks at PTSD as a worker comp issue. And those frontline folks, whether it's a police officer, a firefighter, or a social worker, they all see some really horrible things. And I want to encourage them to take care of themselves and to kind of decrease that stigma for reaching out for mental health treatment.
Well, I appreciate that. You seem very busy, especially right now, to say the least. So thank you again for your flexibility and being here and being a part of the conversation. You're such a champion for kids, and we just
thank you. Well, thank you so much. And I couldn't do what I do without Kentucky Youth Advocates. You all have always had my back and educated me and supported me. And I just so appreciate that.
Well, thank you. And I'm going to now turn it over to my colleague, Shannon Moody.
All right. See you guys later. Bye.
Thanks, Representative Jenkins. Appreciate you.
Thank you. Bye.
All right. Well, thanks for that, Mahak and Tyler. You were phenomenal. Obviously, you have some practice working with legislators, and that's actually what we're going to talk about with you, Tamara. Let's talk a little bit about, kind of your background, like how you got engaged with advocacy and just like why you kind of stepped into this role. And Tyler, if you'd like to start, and then we can switch to Tamara.
Oh, Lord. Well, so I was adopted at age 16, and when I was adopted, and even in foster care, growing up, I didn't want anyone to know that I wasn't in foster care. Didn't want anyone to know because I didn't want them to associate me with those negative stigmas. I wanted them to get to know me for me. So I tried very hard to, be normal, whatever that is. And at being adopted at 16, I was like, I don't want to, be a part of the foster care system anymore. Like I'm free, like this is my breakout moment. But I had a calling apparently, and I received an email one day from Sheila Butler, who is one of the independent living specialists in the Two River regions. And it was about this opportunity to be a part of the Murray State Voices of Commonwealth. Still didn't know what it was. I was like, okay, I'll give it a shot. I'll do something. I'm, 18 years old, whatever, cool. So I remember showing up to one of the meetings in E-Town, the first one there, like an hour early, very nervous. And I get there not knowing anyone whatsoever. And I remember just being lost and overwhelmed throughout the whole meeting. And I was just like, man, like, when do I get to go home? Like, what did I get myself into? This is crazy. And then even after that, going to the different events throughout the state, I was just like, man, I don't think I can do this. I wasn't really connecting with my my group members like that. So several times I tried to quit, but the universe just wouldn't let me be great and walk away from it. So it was crazy because, because of my leadership and just standing out, I was assigned to, be the secretary, vice president, then the acting president, and then being nominated to be the president and voted on to be the president for 2 years, actually, or 1.5 years. So I did step down over this past summer, actually, and that's where Tamara Vest took up. But really, in that leadership position is when I really started to embrace my advocacy, and the rest is history.
Thanks for that, Tyler. And Tamara, do you want to talk about what got you involved and now your role at VOC, and maybe a little bit more about what VOC is?
Sure. Like Tyler, I'm a foster alumni myself, so I spent some time in the foster care system. While I was there, I felt like, I kept reaching for things. I kept trying to advocate for the things that I wanted. And a lot of times, especially as a foster youth, you're kind of like put back in your place. People aren't willing to listen, not as much as they are now, but it has definitely improved. So like Tyler, fate had me cross paths with someone who was a member on the Voices of the Commonwealth Council. Somehow I was in the right place at the right time, and somehow they picked me out of the group of individuals that were there. And this was not a VOC meeting, this was some other meeting, and they came up to me and said, "Hey, you look like you have a story to tell. Would you be willing to do that? This is what the VOC is." And I just looked at them and I said, "Okay, sure. Yeah, I like Tyler." I was like, "I'll give it a shot, I'll see what it's about." And I really thought, someone is finally giving me the chance to speak up about the things that I needed and wanted when I was in care. And I was like, I'm not going to turn that down. So of course, and like Tyler, I started my journey with the VOC, which is the Youth Leadership Council, comprised of current and former foster youth in the state of Kentucky. And we range from the ages of 16 to 23. And we do a lot of work with advocating for foster youth and their needs, social workers' needs, foster parents' needs. We partner with community partners like Community Action and KYA. We do legislative work like Tyler and I worked on last year with some of our other members on the council. And really, when I was with the VOC, I was like Tyler. My first meeting I showed up to with DCBS, they were talking all these acronyms and everything with the child welfare system. And I said, "What is this? I have no idea what I'm doing. I don't know what I got myself into." But I just went with the flow, and I ended up falling in love with advocacy and everything that I could do with it, because there's so many avenues that you can take. And I continued to grow there. I served as Tyler's co-chairman last year and helped him out a lot. And then, like he said, took over the chairperson spot last summer. So.
Congrats on that role too. That's really exciting. And now you are a fellow social worker. Is that correct? You graduated from UK recently. So Tyler had mentioned that you all had worked on a bill last year, Senate Bill 115. Do you all want to talk a little bit about what that was before we jump into what you're hoping to see happen in the future?
Yeah, definitely. So Tamara and myself both were some of the older young people on the council, and we were under the old tuition waiver. So the old tuition waiver was very restricted according to in regards to time. You had like 5 years to use it, and it was consecutive use. It wasn't non-consecutive use. As you know, and many are aware, we have a lot of issues when it comes to instability, when it comes to emotional needs, mental disorders that prohibits us from graduating in 4 years time. But even the average young person, they're not really able to graduate in 4 years. If they are, it's just barely. So we definitely wanted to create something that supported young people in their success. And we just felt that if we were able to, tweak the waiver when it comes to, consecutive use or non-consecutive use, it would allow us to be more successful in our educational journey. And Tamara, I think you gave a lot of input around that as well.
Yes, so I feel like Tyler did more of the face work and the networking and really working with the legislators, and I was there as well, more of like a support, and I worked more on the side of, okay, what do we need in the bill and drafting the bill and things like that. And it definitely taught me a lot about politics, about the legislative process, and I find it highly ironic because when I started my career in college, I was actually going for political science. And I was like, this ain't for me. So obviously I found my calling to be social work, but I realized that after working in legislative policy and advocacy that I can use social work to get into politics as well. So I definitely enjoyed the entire process of the bill that we had passed last year. I definitely look forward to what the future holds for child welfare policy, and I can't wait to just get into that in the future.
So it's not often that young people identify an issue, go get a bill filed, and then have it passed and become law in 1 year. That is incredible.
I mean, we were told. I mean, we were told, like, don't get our hopes up. It's probably not even going to happen. But you know, again, we know how to survive, and we were nearing that 5 years. We were like, you know what, we're going to get this pushed through. You know, we got to be a little aggressive. Like, we're going to get this pushed through. If it kills us, and thank God that, you know, we were able to do that. We just had a lot of support, and it was the right people, the right timing, everything in the world just aligned, and then COVID hit. But you know.
So I heard that it takes some people skills and some policy skills to get that done, and you all, it sounds like, made a great team. What are some things that you're hoping to see happen in the coming years? Like, what are 1 or 2 priorities that, like, really interest you when it comes to child welfare issues in general?
Tamara, I'll let you take that one first.
Okay, for sure. There's a lot of issues that I think should be continuously talked about and worked on. I know Tyler and Representative Jenkins talked about one earlier. It is widely discussed all over, but definitely one of the number ones for me, especially as someone who was in the system and now someone who works for the system and who sees both sides of it, is the conditions that our state workers are in. And specifically, you know, they're overworked and underpaid. So I'd like to focus on minimizing caseloads and paperwork, minimizing staff turnover, because obviously that's a big issue and why the caseloads are so big, and increasing their salaries like Tyler and Representative Jenkins talked about, and also having more of a focus on having opportunities for our state workers to be more of a support for the youth in care, because as someone who is now into it, it seems a bit robotic. The position itself does, you know, you're kind of just following up, asking how things are going, you know, how's school, how are you doing, are you safe, do you feel good in the home? And it feels a bit robotic. And I think that us as new social workers and child welfare workers, we expect to have a position where we should be able to support the youth more, because I don't think the kids in care really see us as supports most of the time. They're kind of like, oh, that's just my caseworker. They do my paperwork. They check up on me. But I would like to see a future in which the case managers and social workers are really more of a support for those youth and a connection for them. And then my second priority, which is also widely discussed, is authentic youth engagement, allowing kids who are in care or formerly in care with lived experience, using that lived experience to hold positions, partnering positions with those who hold decisive power over child welfare policy and decision making.
Definitely. Well, I mean, I could give you guys a whole book of just notes of services and changes that I'm hoping to see, but I'll keep it brief. I definitely do feel that we need to expand the amount of services to the young people, in our child welfare system based off, age and whatnot, as well as lived experience in the system. There are things that young people in kinship care are not able to receive because they weren't in foster care, and vice versa. And the young people who are adopted from foster care are not able to receive because they did not age out of foster care at 18. So I would like to see that more unified, because it's all underneath the out of home care experience. That 9,000 number is of all those young people, not just in foster care, but in any type of out of home situation, group home, if it's in like a medical ward, all those types of things. And then the second thing I would love to see is the increase in just the overall efficiency of the services that we are providing. I often say it doesn't matter how many policy changes, how many legislative changes that we make, if we don't have, the people in positions in a good direct plan of action, then none of those things matter. For example, with the tuition waiver, it's an amazing bill. However, we still need support on the college campuses. Where are our foster liaisons at our universities, at our colleges, at our VOTEC schools, where are they at to support us? We still don't have those things in place. So therefore, the tuition waiver was great. You know, it definitely helps us a lot. However, there's still a deficit in that area of support.
Tyler, I'm so glad that you mentioned young people in relative or fictive kin or kinship care, because you're absolutely right. They don't have access to a lot of the things that kids typically do when they go into out-of-home care, and that's a big disparity that I think folks don't even realize. So that I'm so glad that you brought that up. You know, when thinking about, obviously you guys got into advocacy, you all got into advocacy through the Voices of the Commonwealth and or other connections that you made. Why do you think it's important for young people to advocate? And maybe not just young people who have experienced foster care, but young people in general too, if you want to speak a little bit to that.
Definitely. I think that young people, just in general, we are more connected, and experiences of life are fresh with us. And because we are not, we don't possess the I guess the mental capacity to bottle up our emotions. When we do advocate about something we're passionate about, it's raw. Like, those emotions are there. It gets the people fired up. Therefore, we have more support for a call to action. So that's something that I love seeing, and that's something that I believe is a great variable for young people to advocate.
As well, I think it is very important for young people who have lived experience in foster care and out-of-home care to advocate, because, like Representative Jenkins mentioned earlier, they learn from people who have experience in it, whether that be foster parents, social workers, or kids in care. And who better to assist in transforming this whole system than people with lived experience. And I actually had another privilege, as always, to meet with Commissioner Martha Miranda Straub yesterday. And she said something that really stuck with me and I thought was important when answering this question. She said, "What we bring to the table is who we are." And I think that really just stands for itself. It's very strong. As an advocate who has lived experience, everything I bring to the table is me and my identity and my experiences and the experiences of those who are currently in care, who I work with. And for young people in general, you know, whether you have experience in foster care or not, we are all the future of society. And I think it's the responsibility of our generation to go forward and make changes, whether they're in the child welfare system or not. So I think it's important that, you know, this generation specifically find a cause that they are passionate about and work towards that.
So you all are both obviously passionate and incredibly articulate and do a great job talking about your interests. What is some advice that you would give to young people listening to step out into maybe an uncomfortable space and get involved in advocacy? Like, what's some advice you would give to them?
Woo. Don't hold back. Sometimes you have to be aggressive. And I know everyone doesn't agree with that, but I think that's something that's very needed, especially in this environment. I think, you know, a lot of times because we are young adults, especially adults in leadership, they tend to overlook us or not really implement our concerns or input into the plan of action, you know. But again, you know, I'm here for a reason. You know, my story has weight, my name has weight behind it. And I'm here to, you know, call for a call of action of change here. So I definitely, you know, encourage young people to not be so afraid. Well, you know, and it's okay to even be afraid. Like, I'm still afraid at times, you know, but I believe that the cause is so much bigger than ourselves.
I really thought about this question hard because there's so much that you could try to tell someone who wants to be an advocate, especially with the experience that Tyler and I have. But I came up with a few things, and like Tyler, I believe it goes along with his statement of being a little aggressive, but one thing I actually learned from Tyler was to always ask why. Like, I observed Tyler in his work, and he's always asking why. Why are we doing this? Why is this in place? Why isn't this in place? Why isn't this being done? So when we're making decisions about people's lives, we need to ask why. And when we're making decisions about people's lives, we should never make them without their voice and their experience at the table. And something else that I've also learned throughout my journey, and then just throughout my life experiences as well, is to never accept no. And I know that sometimes you have to accept it for a short period, but always following up on that, because when you give in to no is when you halt your abilities, to my belief. So never accepting no, always asking why, and then networking. I believe I learned that from Tyler as well, as well as other individuals. But networking, it allows you to build your support systems that you're gonna need when you're an advocate. It provides those connections for all those different systems that intersect with whatever you're advocating for. And then talking to your legislators, finding out who your community partners and resources are. And it's very crucial to this type of work because, like I said, everything intersects with one another. So you're at some point going to cross a different path where you're going to be like, okay, I actually know someone who can educate me on this topic or who could help me open this door. So.
Such strong advice too. And it sounds like you all have learned from each other, which is phenomenal. So thinking about, this legislative session, which is a really strange session, right? It's a short session. There's a budget that they have to pass. Representative Jenkins talked a bit about it, but are there any bills that you all are just keeping an eye on and following that you want to see passed?
To be honest with you, Shannon, I have not been keeping up with any of the bills in the session. I've actually been very distracted when it comes to our body of legislatures. I've been very distracted and very disappointed with the amount of, I guess, with the extent of the relationship that they have or don't have with the cabinet here. I do believe it is very unacceptable for Kentucky for the third year in a row, to lead when it comes to child abuse. But, like Tamara said, everything intersects, with different components. And I do think there have been, several bills or ideas that have, been shot down, not supported by our body of legislatures, that has a detrimental effect on young people like myself and Tamara, but also those who are, currently still in here. So that's something that I just been very distracted with here. And I do wish that, we're all able to come and meet at the table, and instead of point the fingers, point the blame, let's come up with a plan of action. Let's really network with one another. This is nonpartisan whatsoever. And if you truly are in legislature, you truly are one of those who are posting the things on Twitter or things on Facebook about the cabinet or the fact that, Kentucky's leading for the third year in a row, then you used to be running down to the cabinet to see what can we do to help? What can we do to stop this? So that's just a little spill from me.
I as well have not kept up with many bills, but there is one that stuck out to me in particular. I have done my research on the legislative website and also the KYA website, but Senate Bill 77, which talks about focusing on requiring more minority representatives in the superintendent selection committees. So like I mentioned and Tyler mentioned several times, everything intersects. So education is a great place to start. And I think that with the current state that society is in towards racial injustice, this bill is very important in moving forward, especially for Kentucky, a step forward in alleviating that. And we know that we have a disproportionate amount of minority racial groups represented in the foster care system. So I think allowing more representatives who represent their identities and their culture gives them a sense of empowerment.
Thank you for that. That's incredibly important. And you identified a data point that we've been sharing for a while about the within the kids count book, especially about the number of kids in out of home care and the disproportionate number of kids of color, and that we need to see some changes as a result of that. So before we close out, are there other things that are on your mind about child welfare policy or child advocacy that you would like to impart before we close out?
Samara, I'll let you go first.
You just had to put me on the spot, didn't you?
Go ahead.
Okay, well, I mean, just like everything I've said, it's hard to sum up everything. I know Tyler and I both could write several books on everything that goes along with Kentucky's kids or kids in care and the child welfare system. But I really believe that if there's anything that you are passionate about, whatever your role is to the child welfare system, anything that you're passionate about, speak up about it, because staying silent does not help at all.
Definitely, definitely. And I think, you know, if you are too afraid or just don't have the means to advocate about child welfare, then support those who do, you know, advocate and who work in this system and to make it up. Definitely. And I definitely, again, just going back on my last statement, I definitely encourage, you know, our body of legislatures to work with our cabinet and, you know, find an amiable solution that works for all of us. Because again, it's not about us, it's about the cause, which is much bigger than us. And that's what keeps me going at 12 o'clock in the morning, you know, working on assignments, also working on advocating for our young people. So.
Well, thank you all so much. I would advocate for folks to keep an eye on both of you, because I think you all are going places, and I would anticipate seeing more of you as we continue to work in this field. I would also encourage folks to take the advice of Tyler and Tamara and support those future advocates, those young people who have lived experience, who can really bring like very good insight and ideas to the table, and to ask those questions like why, or to respond to no with that's not the answer I want, let's keep moving. So we've got some things that we dropped in the chat, including the link to the bill tracker, the link to VOC's Facebook page. You should go check them out, like them, follow what they're doing. They do great work. And then also Tyler's new venture with his consulting firm is the information is in there as well. And again, thank you to Mahak. We appreciate Representative Jenkins being on and imparting her wisdom. And thank you all so much for joining us today.
Man, thank you for having us. You all rock. I love you, Kentucky. See you all.
Thank you, Tyler. Thanks, Tamara.